The two health screenings you can't afford to miss. The Health Source podcast brought to you by the Marshall Health Network starts right now.
You are listening to the Health Source podcast, presented by the Marshall Health Network. Now here's your host, Rick Lord.
Well, hello there and welcome to the Health Source podcast presented by the Marshall Health Network. And we thank you for joining us on your journey toward wellness. And it's always a journey for everyone. A lot of people try to start their New Year's resolution saying, I'm going to get healthy. But a lot of people forget about planning to succeed. And that can be a big issue. Talk a little bit about that with us today is Jodi Biller. She has a lot of experience as a doctor of nursing from West Virginia University. She is a Marshall alum, so you wore your green today. Go Thundering Herd. We don't play favorites here. Again, nurse practitioner for about the past 12 years. Pulmonary medicine experience in clinical care. And as part of what you do, you also deal with population health. So I know you have some immense, spectacular credentials. We'll let you get into exactly what you do. But talk a little bit about as well what population health means for people who might be joining in saying, I've never heard of that. What does that deal with?
Mm-hmm. So, first of all, thank you for having me. This was really exciting. So again, I'm Jodi Biller. I've been a nurse for 18 years. I have always worked somewhere within the Huntington area and in the region. Finished my nurse practitioner, a Master of Science in Nursing through Marshall in 2013, and then started working with our healthcare executive team in population health around April of 2023. Through that, finished my Doctor of Nursing practice at West Virginia University. So, with population health, it means a lot of things to different people. And if you're on the community side versus the business side, we explain a lot about that. So really, population health is kind of a loose term of a high, think about kind of a high level term like Ford Motor Company, right? They make a lot of cars. And so there's a lot of programs that get set up through population health, but it encompasses taking care of the whole person, right? Whether that's with your executive team all the way down to community projects that we work on.
So a lot of people, when they get involved in saying, I want to start my path to wellness, I want to be a healthier me, I want my journey to begin the right way, they tend to focus on the end result instead of the process. And a lot of that process begins with smart planning. So what are some of the impactful things that anyone can do on their unique journey to plan to succeed, to stay healthy?
Well, again, I'd like to take just one step back because with population health, we have a huge population of patients that we take care of.
Sure.
So at Marshall Health Network, we have 1.4 million people in a 40-county region and 4 hospitals within our network. And how do we manage that population? We take targeted data and we drill that down to specific populations of patients. And then we have specific actionable interventions that we give out to people on our care team, whether that be the front desk staff to schedule appointments, a care management nurse to call our high-risk patients or, and check in with them monthly, and even our providers on what patients need and who has an appointment coming up. And we're trying to, historically in the past, care has been delivered in a reactive approach. We wait for you to get there.
Right.
And so what we've done since 2023, and this is a slow churn, but I think you're going to see this a lot on the front end of what we're doing now moving forward into 2025 is we have turned that and we're taking targeted data and we know the patients are coming and we're getting prepped for that for when they come in. And so we do a lot of work around preventative screening to know that, myself, Jodi Biller's coming in 2 weeks and she's due for a mammogram or her yearly labs and she needs a wellness visit. So we're ready for you when you get there.
And it seems to be so challenging because, you talked a lot about what with population health, you're delving into statistics and probabilities and numbers, but people aren't numbers and you can't treat people
That's
like
right.
numbers. So that's kind of a juxtaposition of it all is each person has their unique health and their unique health profile. And so to put numbers to that, it kind of gets tricky at times. So that's where the personal touch comes in as well.
Well, and I'm glad you said that about the numbers because before we were only taking care of people that came through our front door. Now we know who our patient population is and where they live and what type of services that we have to provide that wraparound comprehensive service for them.
So why is primary care so important? A lot of people sit down and they understand, I have to take care of myself, and sometimes things fall through the cracks. But in your eyes, what is it that people need to know right now to make sure that they're getting the primary care that they need, and that they understand what resources and services are out there?
So again, we talk about different levels of care, right? Low risk patients do not get the type of care that a high risk patient gets, right? A low risk patient may be somebody who just comes once a year. And that's your opportunity to sit down with your provider and say, through your annual wellness visit, here's what we need to do for the rest of the year to keep you healthy, right? Here's all the preventive steps. And that may be colon cancer screening, mammogram, yearly lab, checking your A1C, which goes along with diabetes. There's all kinds of different things. And then you have this a higher acuity patient that may have heart failure or COPD. Those people need a high touch model, right? We need to be seeing them at least every 3 to 4 months, in addition to our between visits. And that's where our care management team of nurses comes into play, that are calling patients between appointments, checking in with them. Affordability of medicines is huge, to make sure that, are you taking them? Can you afford them? Oh, by the way, we have this program. Let us bring our internal knowledge of all the resources that we have available to you, so that every patient is getting the same type of care no matter where you are within our healthcare system. Whether you live in Mason County or Cabell County, they're all, all patients are offered the same services.
And relationships matter with these people, and because everyone views their health differently, and ways to stay healthier differently. For instance, my mother is in her 70s. She gets real anxious about her screenings, and about whether it's because she's afraid maybe of what they might find, or she just doesn't know what she's getting into. So I have to tell her, well, the doctors know what they're talking about. Just explain your fears and your anxieties to them, and they'll talk you through it. But a lot of times, and I don't want to put words in everyone's mouth, but for her, for instance, if she had to go in for a stress test, she might be like, well, I don't know, what happens if I'm on a treadmill and I get a heart attack, And in the back of my head, I'm like, well, that's probably the best place. You're literally in a room with the cardiologist, so you're probably going to be okay. But it's that type of fear and anxiety that you guys have to work through sometimes, I think, to get people to understand that, you guys know what you're doing. The physicians understand, and you just have to talk them through that. But that can be challenging at times, I'm sure.
It is challenging, and recently this article came out. To someone on our team introduced this to us, but it said to do primary care right, especially in a patient that has a lot of medical needs, a primary care provider would need 27 hours a day, right? And so that's where these care teams come into place, and how do we provide that type of education to say, oh, Mrs. Smith, I see you're going to have this done. Do you have any questions about your procedure? How can I, help you, or see this through, or even little things become overwhelming. Where am I going to park, and what door do I need to go into? Some of it's just very basic things, right? What's the procedure going to look like? And we're able to kind of talk patients through that and give them that information. It decreases their anxiety. They're ready to go when they get there, so that the clinical staff aren't having to work through that. And so I think that's one of the really cool things that we're doing, is we're taking that patient and getting the outreach ahead of time, rather than it happened there and then trying to backpedal.
Yeah, and Father Time is undefeated. So as you progress and you age, you need to do things at a different pace.
Yeah.
And then when you're 20, you can get away with maybe only seeing your doctor a couple times a year. As you get older, there's screenings, and the advice changes from year to year. They'll say, well, now you need to go in at 40, 45, 50. So you always have to being on top of that. But what are the screenings, if you could simplify it for people out there, maybe? And off the top, I said, these are the two that you can't afford to miss. What would you prioritize in terms of screenings that people out there that are watching or listening have to take care of?
Yeah, especially in our area. We've done something called, and we do this about every 3 years, a community health needs assessment. And we say, what is specific to our population that we take care of within this 40-county region that we definitely need to prioritize? Those two things, mammography, so breast cancer screening, and colon cancer screening. Colon cancer screening is, or not colon cancer screening, but colon cancer is you're more at risk if you have poor nutrition, obesity, and smoking. And especially this area of West Virginia, we have a whole lot of that. And we've recently done a huge colon cancer screening pilot, and we used, it's called Fit DNA or Cologuard. and we identified a patient population with upcoming primary care appointments. This is our very first pilot. I set the project up knowing I wanted to make sure if we screened patients that they were going to have an appointment coming up. Because, again, it was a pilot, but we looked at patients that had upcoming primary care appointments between August the 5th of 2024 until December 31st, 2024. We screened 2,300 people. We had 752 people that returned their test kit and a 16.5% positive rate. And from that, we did not go out and talk to our primary care providers or gastroenterologists or any of our surgeons about how quickly they could get people in. We did not do that. We watched the natural process of how quickly we're able to get patients in after they had a positive result. And the PCPs were referring, and patients had their screening colonoscopies completed within 4 to 8 weeks. And we were socializing that information. We found out that we had one of the quickest turnaround times in West Virginia, which was great. We didn't intend to find that, but we did. And of those patients that were positive, we had one person that had a lesion. So, if you could prevent one person from having advanced colon cancer, that's incredible. And so that's the type of programs that we do with the term population health. But really, it's good care for the community, it's patient-centered, and it's risk-informed.
And it's so important, those screenings, to get them done early because, the statistics, obviously, we're making progress with cancer, which is fantastic, and you hope to continue that and accelerate that. But the statistics clearly show that if you can catch something early, no matter what the cancer is, your outcomes are usually much, much better. So if anyone out there who's watching or listening might have some reticence or anxiety about getting those screenings, trust me, they're important, because if you do, God forbid, find something, if they catch it early, your outcomes are always many percentages better.
We also screened, we didn't go out and screen everybody who was eligible. Again, we used targeted data to make sure we were screening the right people. We excluded patients that had upcoming endoscopy appointments, anybody associated with our gastroenterologist, because they may have some inflammatory bowel issues, things like that. We also excluded anybody who had documented history of colon cancer. So there was a very narrowed population that we used when we did the pilot. But that is something that we're getting ready to go talk about. West Virginia has a state coalition for the Colorectal Roundtable Coalition, and we're going to go talk about the project and how we set that up on May 6th.
Yeah, that's a big deal, and people need to know about those things that are happening in their community. So how can people get involved? Do you have a website or anything that they can look up right now to make sure that they know when that's coming and how to get there?
So one of the things that we set up, first of all, we were talking about population health, right? Well, what does that mean? And again, it means something different to me than what it means to someone in the community. And so we started working with our marketing team, because our PSRs, or patient service representatives, were calling patients. We're like, I don't know what a wellness visit is. We're like, well, how do we get that information out so that people can see it? And we rebranded to something called Wellness Plus. We put the we in wellness, which kind of goes along with the Marshall theme.
Sure.
But that is really our web page that we put all of our information on: annual wellness visits, care management, and healthy aging. And we'll continue to put information on that and develop that web page as we move forward, kind of taking on bringing care to the community instead of the community having to come to us.
That's smart branding there. We are Marshall. We put the we in wellness. I get it. So talk about you a little bit. What drew Jodi Biller to this field, and how did you get involved, and what made you say, you know what, this is how I want to help, and this is how I want to live my life and the career I want to run down?
That's a loaded question, and I'm laughing because
Not loaded. I mean, people want to know about you. They're watching, they're listening, they're like, oh, she knows what she's talking about. Well, let's learn a little bit about Jodi.
So I've been a nurse for 18 years, but I when I started this, I didn't intend to be a nurse, right? I had gone to college. I was in a program for about 2 years and decided this isn't for me. And I packed my stuff and I called my mom and said, I'm coming home. And she said, what are you going to do? And I said, I think I'm going to go be a nurse. And so I came back to Marshall, applied.
Those are calls that only moms can handle, by the way.
Oh, it was terrible. I'm responsible for all of her gray hair on that one. And so I went to school at St. Mary's School of Nursing. I worked in the ICU, full time. Did the RN to BSN through Marshall. Graduated in May. Started a master's program through Marshall to complete the family nurse practitioner track. And at that time, I was working full-time weekends because nobody will fight you for a weekend shift.
Yeah.
And I would do school Monday through Thursday. And then did that for about 7 years. And we at Marshall, well, at the time it was Mountain Health, right? So we formed an accountable care organization, and they were taking volunteers. They're like, we're going to draft people if we don't have someone who really wants to lead the charge. And I was working in a pulmonary clinic. And one of the disease processes we were focused on was COPD. The others were heart failure, diabetes, and stage renal disease. And so, because if I had to follow the rules I wanted to make them, I said, I'll chair the COPD portion of this committee. And after I did
Thinking
that,
ahead, weren't you?
yeah, I was. And then after that, I thought, I'm probably out over my skis. I should go back and get my doctorate. And so I enrolled at WVU to do the Doctor of Nursing practice. Finished that in December of 2022. Still, everybody thinks. I think I'm a testament to this, right? Everybody thinks, oh, you know where you want to end up. And mine hasn't been like that. Mine's kind of the ongoing evolution of constant just change, accomplishment, moving forward. But that's my personality.
Yeah.
I'm involved in a lot of different things. But specifically, in this type of scenario, I had this high-risk population of pulmonary patients that were sticking out on the financials, did not cost a lot of money. And so our executives came to me and said, what are you doing? And I said, well, if they can only come on a Wednesday, I see them on a Wednesday. If they can't afford their inhaler, I get them in a program. And so I was really doing this care management protocol and so what we call now social drivers of health, right? Transportation, food insecurity, all those things. I was finding these little things that worked for patients. And it was the best thing to do because that's what patients need. Meeting patients where they are, making plans very patient-centered. So moving forward, what's next? I don't know.
But see, that's what's great because you practice what you preach. Because we started this off by saying, the most important thing is to have a plan in place for yourself. You seem like a planner, right? Trying to look around corners and see what the future might hold, but also be able to adapt because on your own personal journey and path toward wellness, things might pop up that you need to adapt to or evolve. Yeah. So that seems to fit in perfectly with the type of personality you are and what you've done.
I think at the end of the day, it's how would I want someone to treat me?
Right.
And I try to do that for people, but we also try to really put that on our teams. Treat people how you want to be treated. It is very basic, but it goes a long way. And at Marshall Health Network, we have done so much transformational change over the past 2 years. We have a new CEO, more to come on that, but we are moving in the right direction to really take care to patients and take the best care of patients. And we have an incredible team of people to do that with.
And, we talked about evolving, and as the Marshall Health Network grows and evolves and your role grows and evolves, what's that been like? Because you've been there long enough where you've seen that transformation. Mm-hmm. You've seen where they were and where they're headed. Yeah. What's that been like for you personally and professionally?
Personally, when you again, targeted data, right? So we have these operational dashboards. When I'm seeing the numbers where each of our organizations within Marshall Health Network are all meeting the targeted goals, that's a huge accomplishment. Because, before you might have one organization that would skew the numbers a little bit, you would still meet your overall system level goal, but it's because one organization may be seeing or doing more than the others. But when all of them are pulling their own weight, that is really something to celebrate, and I love to tell people about that.
Yeah, well, let's talk about a little bit about celebrations because we've seen the numbers, and unfortunately, the sad reality is West Virginia still comes in the lower third of all states when it comes to a lot of those health numbers and metrics. But there are some successes along the way. What would have been some things that you've seen over the last few years in the state that has kind of made you stand up and go like, all right, we're headed in the right direction?
Mm-hmm. Again, colon cancer screening, right? Just that one pilot, we increased our colon cancer screening numbers by 20%. It was incredible. I sent that to our director of the cancer center and said, hey, I just want you to know. He knew about the project. I just want you to know, here are the results. And he said, I'm glad you sent me that because we've also increased our cancer registry by 30%. And so there's these little things that one person could do, right? With a team of people. We organized this pilot, but it was really out of the good of I'm looking at the dashboard saying, where can I make an impact and something that you can just do quickly. And so that's where the colon cancer screening initiative came from. I think it's professionally, it is very gratifying to see, sometimes you think I'm only one person, I can't make the change, right? it is extremely gratifying to say, okay, I want you to do this and you to do this and you to do this. To be able to watch the numbers grow as a network, that is really, sometimes you have to savor the moment. I'm always pushing us to the next level. So this time we set the bar high and we're going to get there. But when we get there, we're going to savor the moment for a minute.
And you're back to population health a little bit, because there are some socioeconomic impacts there as well. And in a state like West Virginia, which tends to be very rural and one of the poorer states in the union, that plays into it as well. What are some of the challenges there to get some people that are maybe from the outlying areas or in the rural parts of West Virginia to make sure that they have access to the health care that they need?
Have you ever heard of an organization? It's a nonprofit organization called Faith Health Appalachia.
Yeah.
Okay. So Faith Health Appalachia is a part of the Marshall Health Network, and it was developed just for that reason. There are challenges where patients can't get to us, or somebody needs something immediately and it's out in the community. So Faith Health Appalachia really has taken the charge to develop our community outreach programs, to put those in place. They've also they've also implemented a parish nurse program where we have volunteers of nurses who are in churches that have volunteered to help take care of people in their congregation, whether that be blood pressure checks or, talking to them about screenings that they may need, or, going over medications they're on, whatever that may be. But how do you take care of the people? And so that was one of the challenges, and Faith Health Appalachia has been a solution for that. The other is transportation. And so they have found an organization that we could say we can send a referral to them, and they will coordinate getting that patient back to our clinic.
That's great, because that's a huge obstacle for a lot of people, and things that people might not think about is just being able to get there.
Yep.
They might have the motivation, but if you literally can't get from point A to point B, you're out of luck. So that's awesome. Okay, so I'm going to put you on the spot here, because I know you don't want to make blanket statements, because we already said that everyone's health is unique to them. But give people just some blanket advice about what they can do right now, some encouragement as they start their journey on their path to wellness, about what right now, because if they're listening and watching, they're saying to themselves, okay, I need to get healthier. I need to be a better me. What's your encouragement for those people to start that journey and to get to where they need to go?
Don't underestimate an annual wellness visit. That sets the plan between you and your primary care provider for the rest of the year. Everything that needs to be done is done in that annual wellness visit. Get your yearly labs. That's huge. It checks your kidneys, your liver, your cholesterol, all the things that are important. The screenings are there. We offer them. They're on our website. We have wellness labs that we offer for $25. And that's not a plug for the money. It's on the website. We've been doing that for a few years. But, if you have a high deductible, some people don't want to get their labs because their deductible's so high. Go get the wellness profile.
Sure.
Do that. And same thing for vascular screening. We have offered that for a long time. It's been out there, but it seems like the people who know about it are doing it, and the people who don't know about it aren't doing it. But you can get your carotid arteries, your aorta, your peripheral arteries checked, and you can do individual tests for $45 or all three together for $99. And then the CT calcium scoring it's a CT of your heart that shows your risk for heart disease. That's huge. It's $75. Don't underestimate the power of the wellness visit, though, because that's where you and your provider, you set the plan for the rest of the year, talk through all of those things. And if you want more information on that, if you just Google Marshall Health Network Wellness Labs, all of that information will start popping up, or wellness screenings, it will populate. And I know that because I've done it.
And that's what's so great about the Marshall Health Network. That's one of the positives and advantages of being as diverse and as broad as you guys are, is that there's going to be something there for anybody that needs it. They might have a different problem here or there, but there's probably somebody there that they can get in touch with to figure it out and take care of it. Good stuff. Thank you so much.
Yeah, thanks for having me.
Yeah, and thank you for listening and watching. And by the way, if you are watching right now, just be sure to bookmark this, because we'll be doing these throughout the year. And we thank you for continuing on your path with us. If you're listening right now on Spotify or Apple, be sure to like and subscribe so you'll know when the latest edition has been posted. And again, we plan to do these about twice a month, but of course schedules can change, so we'll put an asterisk next to that one, especially with doctors. You guys are always so busy, so we'll make sure that we get these up in a timely fashion. on schedule as much as possible. But again, just like and subscribe if you're listening on Apple or Spotify, bookmark if you're watching us right now. And we thank you for joining us on this episode of the Health Source podcast, brought to you by the Marshall Health Network. For Jodi Biller and the entire Marshall Health Network, I'm Rick Lord. Until next time, take care.
That was the Health Source podcast, presented by the Marshall Health Network.